Okay, and thank you for that question. I hope that's another unique point about the book. What I'm hoping is that this book will be the first of many editions well into the future. And what we tried to achieve in chapter 10 was asking the authors who are experts in their particular field 3 questions once they had finished their chapter. And the questions were, as you've said, what do we know? What do we really know? What do we think we know, but actually we might not know? And what don't we know? And as obviously asking 100 people that question, we're going to be getting a lot of valuable information that took time to synthesize the different themes and put it into a way that was readable and understandable. And what I'm hoping will happen is that current researchers and future researchers will look at the answers to those questions, especially what do we think we know, but we don't really know, and what don't we know, and maybe start to research to find the answers to those questions. And what I'm hoping in future editions of this book, that the areas that we don't understand will become filled in. And of course, people will always be asking new questions. But I'm hoping that chapter 10 will, first of all, make us a little bit more humble, because we don't really know the answers to every question, but also provide an opportunity for people to start answering those questions. So, it'd be nice in future editions of this book that we'll also be able to acknowledge that question was asked, and here's an answer to that question.
What will be, Jeremy, also the conclusion? For example, if we need to ask, what do you think, what we don't know and what we need to focus on better diagnosis on solar, based on this chapter, on all the things that we are discussing?
Okay, so I think throughout the book, one of the themes that has emerged is, we are obviously within the first generations of humans who can see inside the body in people who are alive. So we have the introduction of X-rays for the shoulder 115 years ago. In the 1970s, we have the introduction of CT and MRI. And then from the end of the 1980s, 1990s, we have the introduction of ultrasound into clinical practice. And from a diagnostic point of view, from an imaging point of view, there was an assumption that whatever we can see that looks a bit different may be the cause of the patient's symptoms. And on the basis of that, we've been promising patients fixes, cures, by repairing their rotator cuff or removing their acromion or reattaching their glenoid fossa. But what we've seen very clearly, and this is discussed in great detail in the book, is that even though we can see inside the body, very often what we're seeing are just probably age-related changes. They're just normal changes that occur as we get older. What that means for the 90% of people most clinicians see who haven't had serious trauma, what it means is that they're having elective surgery on tissues that are not causing their symptoms. And we're all emerging from this horrible pandemic over the last few years. And all of our health systems are struggling. And what we need to do is we need to reframe musculoskeletal care so that we're not reducing the quality of care, but we are trying to reduce the cost of care. And one of the themes that emerges through the book is that non-surgical management, specifically provided by physiotherapists around the world, is not in any way reducing the quality of care, but definitely reducing the cost of care, because a lot of the diagnostic procedures are identifying problems that aren't really problems. And the other part of the diagnostic dilemma is that when you're developing a clinical test, such as a special orthopedic test to identify the structure that's a problem, if the reference tests, such as the X-ray, the MRI, the ultrasound, isn't capable of differentiating people with and without symptoms, then the clinical diagnostic test is also not as valid as we would like it to be. And so another theme in the book is that maybe until somebody invents an MRI machine that rings a bell or flashes a light and says this structural change is the cause of symptoms, maybe what we should be doing, and this is a big theme of chapter 15 in the book about diagnosis and a new classification system for the shoulder, led by Angela Cadigan from New Zealand, that maybe what we should be doing is not being so focused on the structure that's causing the problem, but what's the patient's functional limitation, and what can we do as a healthcare team to improve the patient's function, reduce their disability. And we discuss that in detail and provide some solutions and some answers to that in the book.